So today we're going to talk about herpetic keratitis. The reason being because a lot of patients have been asking me the differences between herpes simplex versus herpes zoster keratitis, and also ever since I posted that amniotic membrane graft post or the video on YouTube, I have had some audiences ask me the same question, and they were wondering because I said something about herpetic keratitis for which I had to use the amniotic membrane graft, and there were some patients or some audiences who were like, oh, you can get herpes of the eyes also. So yes, we're going to quickly talk about that. And yes, I do see herpes of the eyes. I see shingles in the eyes, and so on and so forth. So first we need to know there is a DNA virus, and it includes the herpes simplex virus, herpes zoster virus, varicella zoster viruses also. Herpes simplex is the virus that I get to see a lot in the clinic, where patients are going to present with painful eyes or eye tearing of the eye, red, irritation, photosensitivity, those kind of things. And then herpes zoster is the one that is the shingles virus. So that happens because there is a varicella zoster virus, which is known as the chickenpox virus. And then later on in life, the virus can remain dormant for many, many years in the dorsal root ganglion, in the nerve. And then after many years, when your immune system is probably low, you're immunocompromised, or for whatever reason, you can get some infections, and your immune system goes down, you're stressed out, and then you can get the condition which is known as shingles. Now, do I see shingles in the eyes? Yes, because that is known as the herpes zoster virus, okay? And then I'm going to tell you how I differentiate the two viruses and what is my treatment plan. But first you have to understand you have to have varicella zoster, which is chickenpox, in order to have shingles. You can never have shingles without having chickenpox first. So that's the step. You have to remember that, and that's something that patients are always fascinated with. For instance, my staff, the nurses or the technicians in the room, sometimes ask me, "Hey doc, we got chickenpox. Can we get shingles? Is it contagious? Is it not?" And then I have to tell them the differences, and that's a great question, by the way, because if you have had chickenpox, then you can never get chickenpox again. So that's the rule of thumb. Now, if you're exposed to someone like shingles in the clinic, like a patient comes in and the patient has active lesions or active shingles, and if your immune system is low, then yes, you can get shingles from the patient. But in the second scenario, if the immune system is good, then you cannot get shingles from the patient, okay? But regardless, we clean everything, and if it's active lesions, then it's obviously contagious stage, and we have to clean all the equipment. Now, this other scenario is if you never had chickenpox, let's say, and you're exposed to someone in the clinic, like a patient who has active shingles. Are you going to get shingles, or are you going to get chickenpox? Remember, you have to have chickenpox first in order to get shingles. So you can get chickenpox from that patient. And then there's another scenario, the third scenario, which is kind of very rare, but I heard about it, so I just wanted to just briefly talk about it. There was a patient who said she had a little kid, and the little kid went to the daycare center. The kid had been vaccinated for chickenpox, but ended up getting shingles from an adult in the daycare center. So maybe someone's supervisor or someone's parent or whoever was in the daycare center had shingles, and the little baby kid ended up getting shingles, which is rare for a little kid to have. But anyhow, those are the different scenarios. We're going to discuss the treatment plan in a little bit, but quickly let me show you the staining pattern. So how do I differentiate between herpes simplex versus herpes zoster, and then the treatment plan, okay? So let's quickly take you to my computer screen, and I'm going to show you herpes simplex first, because that's the one that I get to see a lot in the clinic. So here you can see the herpes simplex tree branching pattern. You can see here, and then you can also see the terminal bulbs, okay? So if you look here, these are the terminal bulbs you see in the end. So that's a typical herpes simplex dendrites tree branching pattern. Now this is the picture of the cornea. We also have the fundus camera, which takes pictures of the anterior sag, but I wanted to just show you this one because this looks very similar also. So that's herpes simplex, and then in order to see what the herpes zoster virus looks like, that's a little bit different, and this is a great picture here. You can see my reflection in there too. So here's the herpes zoster pseudodendrites. So if you look at the tree branching pattern, that's missing. You don't see the typical classic tree branching pattern, and also there are no terminal bulbs. So this is known as a pseudodendrite. So this is herpes zoster. And even the staining pattern is not as specific and as dense as it was in the herpes simplex. So let's go back to the